We also know that levels of physical biomarkers of inflammation rise and fall with psychiatric symptoms. In teens and adults with depression, bipolar disorder, anxiety disorders, the physical levels of inflammatory biomarkers go significantly up during periods when symptoms worsen and go significantly down when patients go into remission. And this is true even when there are no outward signs of physical disease. There's no autoimmune disease, no sign of inflammation. Most recently, researchers at Hopkins were able to show that they could use these levels of blood biomarkers to predict a suicide attempt in psychiatric patients. All right, so what's going on here? How can trauma and the stress immune response be connected to a loss of synapses in the brain? How is inflammation in the body causing a lack of synapses in the brain? So you might have been listening to this presentation and not have thought that that was even a question. But in fact, in the scientific world, that's been a mind-blowing mystery. And that's because for 300 years, we can thank René Descartes when he first came up with the idea of mind-body dualism, that although the body from here down is very influenced by the immune system, the brain for 300 years has been categorically thought in medical dogma to be immune privileged. And that's for two reasons. One, the blood-brain barrier is this big congregation of red blood cells at the base of the brain that's so thick that it doesn't let any of these inflammatory molecules go up or down between your central nervous system, your cerebral spinal fluid, and the brain itself. The brain has been categorically thought to be the only organ in the body that is immune privileged, and for anatomical reasons as well. So inflammation is what we think of as being red, hot, painful, and swollen. So if you're hanging pictures or decorations and you mistakenly hit your thumb, it's going to get red, hot, painful, and swollen. It swells up as white blood cells rush to the site of injury. But your brain can't swell because it has the skull, right? So it can't really swell up. That wouldn't be anatomically smart across evolutionary time. Unless there are rare instances where if there is a big traumatic brain injury in a car accident, the brain will swell and you have to drill into the skull and relieve the pressure. So neuroinflammation has thought to be impossible. In fact, as little ago as just 6 years ago, it was still written in the scientific literature as an undisputed fact that the brain could not be afflicted by the immune system. So this growing data that we just discussed, showing a link between physical inflammation and psychiatric disorders and mood disorders, has completely baffled and confounded the medical community for 2 decades. And it turns out that the answer that solves this mystery of how this can be related, physical inflammation in the body and a lack of neural connectivity in the brain, all comes down to one tiny little cell called microglia. Remember that name because you're going to hear it a lot in the psychiatric and mental health community in the next 10 years. I promise you, it is changing the field and causing textbooks to be rewritten. So when I said the brain was immune privileged, that also meant, according to medical dogma, that there were no immune cells in the brain. There is this tiny little cell called microglia, which has long been thought to be a very boring housekeeper cell. Well, lo and behold, these tiny little microglial cells, they pair off from the white blood cell. They travel up into the brain on the 9th day of gestation, and there they've been residing all across human history, and all of medicine missed it. Microglia and white blood cells are cousins in the immune system's police force. Microglia function as the white blood cells of the brain. They have a good role, and that is to repair neurons and mend the brain. But just as when the body detects an incoming threat, whether it's infection or bacteria or a chemical toxin or a virus or a pathogen or chronic unpredictable stress, white blood cells in the body get ramped up from inflammatory chemicals to attack the body's tissues and promote disease and inflammation. Microglia are activated by the same stressors on the same timeline. So when they perceive a threat in the brain, toxic stress, emotional trauma, social threats, pathogens, chemical toxins, bacteria, viruses, they stop emitting those good protective chemicals and they morph into these big bushy Pac-Men and they start to chomp away at synapses in the brain. This is a preview. It's the book that I've just wrapped for Random House. And I look at these cells as the angel and the assassin. So in nurturing environments, microglia are what we think of as the angels of the brain. They secrete nutrients to stimulate healthy neurons and grow new synapses and strengthen brain connectivity and help mend sick neurons. But in unhealthy or toxic environments in which there is chronic adversity and individuals are stuck on the first half of the stress cycle, microglia are the brain's untimely assassins.